Hello and welcome to another episode of Best Foot Forward. I'm Dr. Scott Kilberg. Today I'm going to talk about something called tarsal tunnel syndrome. Now most of you are probably very unfamiliar with what this condition is, but you may be familiar with the variation of that occurs in the hand and wrist called carpal tunnel syndrome. Essentially, tarsal tunnel syndrome is an entrapment of a nerve that runs around the inner side of the ankle that travels through an area called the tarsal tunnel. Now this region is a spot around the inner side of the ankle in which there's a ligament that passes from one bone to the next, and underneath this ligament lies an artery, a vein, a couple of tendons, as well as a nerve. And when this nerve gets entrapped or irritated inside this tighter space, it can create symptoms like burning, tingling, or just simply numbness in the side of the heel along the inner side, or even in the bottom of the foot extending all the way to the toes. This condition is worsened with activity and sometimes can be felt even in rest if there's just continued pressure on the nerve itself. Now it has a wide variety of different causes. A lot of times there's just simply issues with the structure of the foot around the ankle that creates tightening or a sense of tension across this ligament, which then pushes down onto the nerve itself. Occasionally there can be masses that can form inside this tarsal tunnel. These can include cysts and expansions of tendons and other issues that can cause direct pressure against the nerve. But more often than not, it's related to one's foot structure and tension across the ligament that sort of binds down this whole area and keeps the nerve and tendons and arteries and veins inside that space. Tarsal tunnel syndrome can be very painful and can cause a lot of limitation of activity, and also having numbness in the side or the bottom of the foot can also be very distracting as well. Tarsal tunnel syndrome can be treated in a wide variety of different ways. Conservative treatment can be performed, which is often successful in getting rid of the symptoms. Now this usually has to involve bracing or other means to try to control the foot structure of the area around the ankle and controlling the way that the ankle moves in order to reduce and restrict the tension and the irritation against the nerve itself. Oftentimes we have to inject steroid into this tarsal tunnel directly in order to try to reduce the inflammation around the nerve and help calm the symptoms down. Or oral anti-inflammatory medications can be used, although they're not typically as effective as the injections. Occasionally physical therapy can be used to increase the mobility around the ankle, and sometimes people have to be completely immobilized in order to stop entire motion around the foot at the ankle in order to relieve this condition. However, in a lot of cases, we do have to perform surgery in order to release the nerve and sort of decompress it. Now this surgery involves making an incision on the inner side of the ankle, and underneath this area we find the ligament, which has to be released in order to reduce the pressure against the nerve itself. Now this tarsal tunnel release surgery is very successful and most often than not results in complete resolution of all the symptoms. Occasionally scar tissue can form in this area which can recreate the condition, but this is fairly uncommon as most cases are very successful. Well, I hope you found this video informative. Look for the next episode of Best Foot Forward soon.